Buonasera.
Good evening. We are here for the last lecture at our festival, the Festival dell'Economia. I'm here with Tito Boeri, Innocenzo La Terza, Innocenzo Cipolletta, Ettore Collini, and the new mayor of Trento, whom I would like to welcome for being here with us today. This is the final event of a Festival dell'Economia, which has been certainly different from the previous editions. This is the 15th edition, taking place in an emergency period, but we strongly wanted the festival to take place, no matter which difficulties we had to overcome. Well, this is because we believe that the festival has a capability of providing information and being innovative in relation to the economic topics of the present time. And we believe that it was necessary to do it exactly in this period. So in the coming days, we will make a few evaluations, we will monitor results, but we believe that results have been good because we had approximately 6 million contacts, visits, not only from Italy, but also internationally. So these were the visits to the festival website. And then, of course, we have all the contacts on the social media that makes the message of the festival even stronger. Well, I believe that we have touched upon very important topics. Yesterday, we had Minister Amendola with us, and Mr. Conte, the head of the Italian government. We have focused on topics that are relevant for our country, so the festival has brought information about national economy, national politics. So we have been glad to have Trentino as the stage for all these themes. So I would like to thank all those who have believed in the festival. Thank you very much to all the people who are here with me on the stage, who from the very beginning supported this initiative, fully aware of the fact that the festival, notwithstanding the difficulties, would have provided a significant added value. So I would like to thank all those who have worked in the backstage, because after all, the work of the backstage has been amazing, because we were able to pass the message beyond these walls. Communication, the press office, large events, all the journalists who have taken part in the festival, helping us manage our debates. So this is the last contribution, and I would like to leave you with the hope to have you all in flesh and bones at the next festival. The festival is important for Trento, for the Trentino region, for our city. We want our squares and streets to fill up again with all the supporters and friends of our festival. That's my wish for next year, and we're going to work hard on that. But we believe that once more we were able to demonstrate that Trentino and the Festival dell'Economia want to hold a central position regarding the topics we have debated here. Thank you very much and enjoy your evening. Thank you very much, President. Right. We are here for the final event of our festival, which is Angus DEATON's lecture. That is the perfect closure to this festival. The opening lecture was by Esther Duflo, who in 2019 was awarded the Nobel Prize because her experimental method has significantly contributed to appropriate measures to contrast poverty in developing countries. Well, 5 years before, Angus DEATON had received the Nobel Prize for contributing to the analysis and the definition of appropriate economic measures to reduce inequality and fight poverty in developed countries. So from developing to developed countries. Well, the methodological contribution provided by Professor DEATON resides in the understanding of the behavior and choices of consumers. And amongst the motivations of the Nobel Prize, one could actually read that to fight poverty, to reduce poverty, it is necessary to have an excellent knowledge of the decisions and the choices made by consumers. This research field has always been pursued by Angus DEATON. Some of his writings, such as Economics and Consumer Behavior, have become a reference for all those who study economy. I remember the text with John Muhlbauer. Angus DEATON's scientific career has continued on these topics, so it is a dream to have him here with us today. For years and years, we have tried to invite him to the festival. He's here today, only virtually, but hopefully he'll be able to come in person very soon, whenever these restrictions are eliminated and whenever traveling is allowed and possible again. I'm not going to list all the awards Angus DEATON has been bestowed during his highly productive career since 1983 at Princeton University. He received the Frisch Medal of the Econometric Society. He was president of the American Economic Association. He has been a member of the American Philosophical Association as well, and of the Academy of Sciences, to testify his fruitful exchange with different disciplines. Angus DEATON has published very influential books such as The Great Escape, and last but not least, the book Death of Despair, written together with Dan Case, presented about 1 hour ago here at the festival. A highly significant book, focusing on an alarming evidence about inequality in the United States, i.e., the increase in mortality in some areas of the United States, affecting predominantly people with a low education level. White Americans, so we're not talking about other ethnic groups that had a high mortality rate in the past, and most likely related to despair and isolation, as well as social marginalization. In his lecture today, Angus DEATON is going to explain to us how economic inequalities interact with inequalities that are associated to pandemics, to the healthcare crisis. So how economic inequalities overlap with health inequalities. Talking about what is actually happening today in the United States on the eve of the American elections. I believe this is going to be very interesting, so I do not want to steal any more time away from Angus. Thank you very much once more for being here with us. You have the floor, Angus.
Thank you so much, Tito. That's a very generous introduction. I'm so sorry that Anne and I are not there. Spending time in Italy is one of the most favorite things we like to do. And as you know, we've tried to come to Trento before and it's never really worked out. And I was so looking forward to it this year. And like you, I hope very much that we'll be there next year. I'm also hoping that that will I'm also extremely grateful to you and the organizers for inviting us to come and talk about our book. And I'm going to talk about what's happened, COVID in the light of the work that we did in the book. So let me share my screen and bring up my my thing somewhere. There we go. Okay, I hope that's visible. What I'm going to do is talk a little bit about pandemics and inequalities in a general way. And then I want to go back and pick up where Anne left off and talk about the divisions that we see before COVID came along, and then see how those interact with COVID. When I've been talking about this, I find the following 4 quotes really useful to set their stage. One is by the great Rudolf Virchow, who was a cell biologist who in fact invented cell biology, a great doctor, but who also spent time thinking about inequalities in health. And this quote says that medical statistics are our standard of measurement. We will weigh life for life and see where the dead lie thicker, among the workers or among the privileged. You can see why he's a sort of hero to the social determinants of health literature. Paul Farmer, one of the founders of Partners in Health, says that inequalities have powerfully sculpted not only the distribution of infectious diseases, but the course of health outcomes among the afflicted. That was written nearly 20 years ago. It could have been written about the epidemic today. Walter Scheidel, the classical historian, writes 4 different kinds of violent ruptures have flattened inequalities: mass mobilization, warfare, transformative revolutions, state failure, and lethal pandemics. Though I think he, like everybody else, has been writing and noting that if this pandemic is going to flatten inequality, it certainly isn't happening yet. And then a more contemporary television quote: a situation like this, it highlights the problems that already exist in society. People haven't noticed. Suddenly you see things. It's like an X-ray machine. It's from Anderson Cooper. So pandemics often expose and often exaggerate the long-standing inequalities between people and groups, and we'll see some of that. So old inequalities that we've known about for a long time are salient in new ways and become starkly visible. There's also new inequalities appear that we hadn't really thought of, and which are to do with the specific circumstances of the pandemic. And that's true in earnings, in jobs, and in education. There's also inequalities between people in different countries, between rich and poor countries, and even within rich countries. And one of the things that we've been very interested in is whether what will be the public change of attitudes towards the inequalities that we've studied. And will the inequalities that we put up with for a long time become completely intolerable in the new circumstances? And what can policy do to help that? Of course, the cynic would say, well, all that happens is the world gets more and more unequal, and we just revise our idea of what is or is not tolerable. So I'm going to start with the American parting of the ways about inequalities before the pandemics and the ones that Anne just talked about in our book, Deaths of Despair. I particularly want to focus on the inequality around the 4-year college degree, BA degree, in labor force participation, in earnings, in the quality of jobs, in marriage, in childbearing, church going, in experiences of pain and of disability and socializing. Across all these areas of life, all of which are important to life, there's becoming an increasing division between those who have this 4-year degree and those who don't. And as Anne noted, about 1/3 of Americans have a 4-year college degree, 2/3 do not. So we're not talking about a majority who's doing fine, we're talking about a minority who's doing fine. And as we'll see in life itself. In our book, we trace the roots of this destruction to the destruction of the labor market for less educated workers. Michael Sandel, the Harvard political philosopher, has a new book out last week called The Tyranny of the Meritocracy. And he has this phrase that the college degree has become a condition for dignified work and of social esteem, and that without the college degree, you risk indignity and humiliation. And even lifespans are diverging. So the next slide, this shows life expectancy at age 25. You can't really look at life expectancy at birth by education because you don't know whether people go to college or not. And the left-hand picture here shows men and women. The left-hand, the scale goes from 45 to age 60. Remember, these people are 25 already. So if you have 60 years left, you expect to die at around age 85, which is sort of what you would expect. So the blue line is for men. Sorry, the blue line is for people with the whole country, with or without a BA. The red line is for people with a BA, and the darker red line at the bottom is for people without a BA. And of course, we're running from 1990 through to 2018 here. And what you can see is this thing that Anne referred to, that if you look at the blue line, life expectancy has been rising, but then it reached its peak in about 2010 to 2012. And that it's never returned to that value. It fell for 3 years and then a slight uptick in 2018. But all of that is due to bad things happening to people without a BA, whereas people without a BA, even though there's been some slowing in the rate of increase, are still just doing fine. Thank you very much. You can see the same is true for women, where it's the people without a BA who are suffering, less slowing among women, and also not so much progress among women at all from 1990 through to 2018. So I'm not going to go through this in detail, but the left-hand side is men, the right-hand side is women again. This is a narrower definition of life expectancy, which is how many years can you expect to live at age 25 until you get to your 75th year. So there's 50 years between 25 and 75. There was no mortality at all. You would live 50 years. So this number can't be bigger than 50. And as I say, men and women, the red lines are for whites. The green lines are for blacks, and men and women again. And what you see here is pretty extraordinary. I mean, if you take the whites without a BA, men and women, there's been really no progress at all over the last 30 years. For women, it's actually declined over that period. For people with a BA, you see the progress again. And also there's been an incredible widening for blacks too, so that blacks without a BA and blacks with a BA are diverging rapidly. The same is true for women. And this, much of the discussion in America is about class versus race, and if class is measured by education. You're in a situation here where blacks and whites with a BA are now much closer to one another than blacks with a BA and blacks without a BA. The other thing that's worth noticing is blacks have been catching up with whites, much faster slopes for these lines than for whites, until about 2013. And then bad things began to happen to blacks too after 2013. Most of that is associated with drugs getting into the black communities. So you've got this very complicated picture of widening gaps, widening inequalities around the BA degree, and the BA degree becoming almost as important as race in determining what's happening to lives. Now, as Anne said, along with this, there are widening gaps in marriage and labor force participation in earnings and disability and in pain. And taken together, many aspects of well-being are coming apart in America along this educational divide. And once again, we often call this the more and the less educated, but that makes it sound much more equal than it is. The more educated here are only a third of the population who have BAs. All right, so what's causing the split? Smoking-related disease, especially for white women who started later and quit later. Deaths of despair, suicides, alcohol, drugs, all with a self-inflicted component, of which drug doses are the most important of these, drug overdoses. But it's not just a drug epidemic. People tend to say, well, you know, what's all this about deaths of despair? It's just a drug epidemic. Well, I don't know what just means in that context. But the important thing to note is that only people are dying from drug overdoses. The increase in drug overdoses is only among people who do not have the BA degree. So one way of putting it is the BA, in fact, is a sort of vaccine against the despair that is killing those without a BA. Again, the labor market is a key part of the story here. And then comes COVID-19. So first of all, there's a widening of pre-existing inequalities. So the less skilled, poorer, more deprived are suffering more in both risk of life and in earnings. Those are the people in retail, those are the people in healthcare, those are the people in transportation, in essential workers, people in meatpacking plants and so on. And so the BAs get to stay home and do, you know, do telework or whatever, Zoom calls like this. Whereas the less educated are predominantly among those who can. So this is widening this gradient of health between low and high income and widening income inequality at the same time. So it comes in as a wedge that makes differences in disease worse and differences in incomes worse, as if they were not bad enough already. The other thing that happens is that pre-existing conditions, and you know this from the experience in Italy too, make death much more likely. The sick suffer even more. Healthcare appears to really matter for this disease. Lower quality healthcare, to start with, widens the gaps even further. And a lot of this is to do with segregation and transportation. The way that Blacks in America are very segregated, and people who live in multi-generational families much more likely to spread this disease. Of course, there's also huge concerns about children in schooling, the rich and the poor, these already wide educational gaps between wealthier and less wealthy kids. Families will widen and perhaps last for many years. You can also see that Anne talked about the employment population ratio. This is for men and for the whole population. The other point, every time there's a recession, people drop out of the labor force and they come back, but never quite the same peak again. And you can see what's happened in this with this pandemic, a huge decrease in the employment population ratio. It's picking up again now, it's still far away. So here are some new inequalities. As you saw in the graphs, the deaths of despair, at least until 2013, spared African Americans. But African Americans have been more likely to be infected and more likely to die. So here's CDC data as of September 22nd. It's 82% of data have the data and 143,000 deaths in all. This is a time when there were nearly 200,000 deaths. So that it's not a full record because not all states are reporting. And I do want to put a big warning here because these numbers are controversial. They keep changing. Every time I look at them, they look different. The pandemic is not done yet. It's still spreading. But if you look at these numbers, these are the usual divisions: Hispanic, Latino, AIAN, or American Indian Alaska Natives, Asian, Black, non-Hispanic, Native Hawaiian, white, non-Hispanic, and other. And you can see that these numbers in brackets here are the proportion of the population, 60% white non-Hispanics, 12% Black non-Hispanics, and 18.5% Hispanic. And if you look at the deaths, you can see that Black non-Hispanics have almost twice the number of deaths, the fraction of the population, whereas everybody else is doing relatively okay. Whites is less. There's been a lot of dispute, a lot of assumptions that Hispanics are doing badly too, but that's in fact not the case on these data. Of course, let me iterate again, these data are not complete. There are lots of parts of America not covered here, and the final total might be quite different. But the key takeaway here is that Blacks who've been doing relatively well, catching up with whites, that's been taken away from them in this pandemic. Um, say more about ethnicity and race. Pre-COVID, Black mortality rates were higher than white mortality rates. Pre-COVID, Hispanic mortality rates were lower than white rates in the US. And that's concordant with the pandemic data I've just shown you. In the UK, by contrast, Blacks have higher COVID mortality rates than whites during the pandemic, but had lower pre-COVID mortality, which is an interesting contrast. When I first started looking at these early in the pandemic, Native Americans were hit very hard, especially Navajo in New Mexico and Arizona. That's no longer true. They clearly got their act together and took the appropriate public health measures. So the mortality rates are changing around the world as it moves outwards from international trading centers to other cities and to rural areas. Let me say a few words about political inequality in the US. The US has done very badly, but then a lot of other countries have done very badly too. So I don't want to say too much about beat up on the US too much, though there is a lot to beat up on. But one particular thing is the unequal democracy that we have. The power in the Senate is unequally distributed, so each state has 2 seats in the Senate. So if you take big population states, California, Texas, Florida, and New York, they have 1/3 of the US population, but they only have 8% of the Senate seats. They're even more unequal for COVID deaths. 22% of COVID deaths, this is of late September, recent data, in 2 states, New York and New Jersey, and they only have 4% of the Senate. 68% of COVID deaths in 10 states, and they have only 20% of the Senate. So the rural states where people don't know anyone who's died, haven't seen anyone who's died, have blocking power over states with many deaths. The House of Representatives is better because its seats are related to population. But as the deaths have spread from blue cities and states, Democratic cities and states, to red cities and states, I thought this would then lead to more assistance as a higher percentage of the Senate had constituents who were hurting. It actually didn't happen, and I was wrong. My guess is, I'm very cynical about this, is that as long as the stock market stays up, it's hard to get people to vote for large-scale assistance. When the stock market crashes, people tend to do things, but the stock market stayed up. But the general point here is the geographical concentration of the epidemic actually matters. Let me say a few words about international inequality. America was coming apart before COVID. America is coming apart more with COVID as the rest of the world coming apart too. Well, let me start with something that I'm sure is familiar to many people listening, that the standard pattern is that GDP per capita, high GDP per capita countries have good health, so that life expectancy goes with GDP per capita. To those who have will be given. That's been true for at least a century. Sam Preston in 1975 took the data back into the 1920s. And some economists have even argued that wealth is health, let countries grow, and health will look after itself. And indeed, here's the latest curve from the Oxford wonderful group, Our World in Data group. This was taken from their website a couple of days ago. And each, you have life expectancy on the vertical axis. On the horizontal axis, you have a log scale of GDP per capita. And the countries are shown there as dots. And the area of the dots is proportional to the population of the people. But the main point I just want to make here is this enormous, strongly positive correlation between life expectancy on the one hand and GDP per capita on the other hand. Now, what is strange during this epidemic is we'd surely expect it to continue. That rich countries have all the advantages. You have better healthcare, we have better healthcare. There's more money, more infrastructure, healthier populations to start with. We have better doctors, a lot more of them, better hospitals, more of them, all of those sort of things. So what you would expect is that the richer countries would do much better, say in terms of deaths per head. But here's the graph again from the Oxford group. And again, I pulled this just a few days ago. This looks like the other graph. Here's the log scale along the bottom here. Here's the confirmed COVID-19 deaths per million people. But the thing about this is it looks the same, but it's exactly the wrong way around, right? So what's happening is there are fewer deaths per capita in the poor countries and many, many more deaths per capita in Ireland, the US, Switzerland, Sweden, Spain, and not at all in very few in Uganda, Togo, Central African Republic. You say, okay, those are different, but if you look at just Europe and North America, you've still got a strong positive correlation, even without Haiti as an outlier. You could regard Haiti as really part of Africa in some sense. But here you got still a strong positive correlation within Europe and North America. It's very puzzling. So why might this have happened? First of all, it's early days in the pandemic and the pattern may reverse over time. And a lot of people think that's going to happen. So rich countries have the trading hubs, which are early spreaders. The same with individuals, it spreads from the rich first and then to the poor, from the global elite to those who have limited measure of control. There's no standardization of reporting of COVID deaths across countries, even within Europe. Some countries count a much larger number of people than others, and there's possible massive undercounting in poor countries. It's also true, should be on this slide, but it's not, that poorer countries, particularly in Africa, are much younger than richer countries. And that accounts for some of the differences in death rates because kids get this disease but don't die from it. That itself is a little bit puzzling because respiratory disease is perhaps the most common cause of infant mortality in poor countries. So you've got a lot of kids who die from respiratory infections even without COVID, and you'd expect them to be prime targets, and we're not really seeing that happening. So the slowing of globalization might compress income inequalities within countries. If the loss of income is proportional to the number of COVID deaths per person, we might get a compression of income inequalities. However, my guess is that this is a genuine phenomenon. I'm not very sure about that guess, but it seems like the pandemic's gone on long enough now, but I would not be surprised to be wrong. And if so, this pattern of international health inequalities may be the only place where COVID makes the world more equal. So thank you very much. That's all I have to say.
Lecture. While you were talking, I already received, I'm sorry, I was looking at my iPad. This is simply because I'm receiving, unfortunately, given that the audience is not here in presence, I'm receiving questions on my iPad. So I've received already several questions for you, and I will just forward them to you, and then I have some questions myself. But
Right.
Adesso passo all'italiano perché allora.
Very well. The first question we have received is by Eugenio Loprete, who claims pandemics has increased inequality. What about a carbon tax?
So far, so and about carbon tax so far. So, una carbon tax necessaria.
So a carbon tax to contrast climate change will probably further increase inequality. So perhaps some claim that heritage tax should be increased. What do you think of this? How can we contrast this trend towards inequality?
Qualities and inheritance taxes and
inevitable.
So
yes, I mean, I think that it depends very much what you do with the proceeds of the carbon tax. And that seems to be an extremely important thing that's not always adequately discussed. So that, you know, you could imagine a carbon tax which was levied on, you know, all uses of carbon, and then the revenue from that carbon tax was given equally to everybody in the whole population, or it could be given in a way that favored the relatively not so well off. So within countries, the carbon tax could be an important source of reduction of inequality. I think in France that was tried, but it was a disaster because they used it to reduce the wealth tax instead of using it to make the tax system more progressive. So that's a major source in which the carbon tax can be used positively. Across countries, it's a little less clear. The biggest payer of an international carbon tax would be China, which is sort of in the middle of the income distribution. But it's also true a lot of poor countries could benefit from that. So another variant you could have of this would be that the international carbon tax would be levied on carbon and would be used to build global public goods, for instance, to improve international health systems, to research into diseases that are only a problem for poor countries. So I don't think there's any necessity that a carbon tax would make the world more unequal. It depends very much on how it's used.
Fabrizio Tortori had asked a similar question, so I'm not repeating it. Now we have a question which is related to the international scenario and the relationship between the US and China. It's a little bit of a digression, but I would like to ask you the question. Prior to the pandemics, trade tensions between US and China have slowed down the international economic cycle. Which scenario can we hypothesize in the relationship between China and the US after the elections on the 3rd of November?
Well, yes, the future is always hard to predict, and we don't know which way the election's going to come out. But let me say a couple of things. I mean, one is that globalization was the hyper-globalization that peaked in the early years of this century was already declining a bit after the financial crisis in 2008. So it's not just pandemic related, and it's not just Donald Trump and American policy related. So I would expect that trend to go on. That I think a lot of people have seen the negative consequences of globalization as well as the positive ones. And I think there will be some continuing backing away from that. The pandemic has certainly accelerated that. I don't think I think almost everyone in the United States, whatever political stripe, does not think it's a good idea that we should depend on many of our essential drugs come from India and China. And that was probably not a good idea. When I learned about international trade theory many, many years ago, there was always an exception for national security, and national security would include pandemics. But, that said, it's very important to realize that, blocking off international trade and trying to become autonomous is not good for many sorts of disasters. And remember, a pandemic is a very unusual sort of disaster because it's hitting all countries at the same time. If you compare that with a tsunami or with a hurricane, being able to get help from abroad is really, really important thing. So we have to be careful there. But I guess to come back to China, I think that one of the things that certainly changed during President Trump's presidency is many Americans are much, much more skeptical of China than was the case before. And, the jobs going to China and the pulling back from that relationship is something that's been more associated with the Democrats in the past than with the Republicans. And I think on that, apart from the rhetoric, the terrible rhetoric, I don't think there's a huge difference between Donald Trump and Joe Biden when it comes to the way forward on Chinese policy. The word is that the Chinese want Joe Biden to win the election, and they say that's because Trump is unpredictable, not because they think that Biden's policies will be any more favorable towards China. I don't really think they will be. I'm not sure that answers your question, but it tells you about all I know on this. So thank you.
Thank you very much, Angus. Then we have another question. It is necessary to understand, and you have rightly stressed, that there are many caveats regarding international inequality. First of all, the collection of data or the standardization of data, the timing, the pandemics has developed in the most developed countries first and then has moved to other countries, and we still have to see whether this distribution of mortality in relation to per capita income will continue in time. However, inequalities in each single country is pretty worrisome. And you have stressed that rural areas are the ones that seem to be more, that seems to be against more care and more health spending, since the pandemics has actually concentrated in large cities and not so much in rural areas. However, it also seems, and this is what we're actually witnessing in Europe, it seems that the pandemics in the end also reaches rural areas, and rural areas usually have a lower quality of health service compared to cities. So it is true that you have a lower number of cases, but these cases can be leading to higher mortality rates. So it is necessary to revolutionize the healthcare system. In Italy, there is a huge difference from region to region. There are regions like Lombardy that have performed very poorly during the crisis. Other regions had a completely different model. They had some large hospitals located in the main cities. Other regions, like the Veneto region, there was a more diffuse type of healthcare. Maybe this type of problem could also persuade the rural areas in the United States, where you have a lower density of population, but probably also a lower quality of health care. Well, this could persuade them to support a program to relaunch a better healthcare system in the United States. What do you think of this?
There's a lot of really good questions in that question, and they're not, I think, all the same. One of the things, I think it's hard to generalize across Europe and the United States because our healthcare system is so different. We have this crazy system of tying healthcare to employment. And so during the pandemic, when people lost their jobs, a lot of people lost their healthcare. We don't actually know yet how many of those 20 million or so actually picked up healthcare somewhere else, or who just went without. But not having healthcare and not having insurance in the middle of a pandemic is obviously a terrible idea. And Anne and I certainly hope that what will happen post-pandemic is that the poor performance of the healthcare system will make it easier to have sensible reforms. But, there's a lot of healthcare that's paid for one way or another in the US and in Europe. Healthcare is not funded through employment, or not directly. It's much more funded through, an equal or proportional burden on people's incomes, rather than the US, where it's like a poll tax. And that's one of the things we emphasize in our book. The other thing that you have to say is that rural areas are always going to be harder to have healthcare, just because of the lack of population density. You can't have a hospital in every village. And, Anne and I, in summers where there's not a pandemic, spend our time in Montana, which is only 1 million people, and it's a huge, huge area. And, a lot of people can't get healthcare because there's only 1 or 2 hospitals in the whole state. And, that's part of the geography. We're never going to equalize that. The other thing that's really important in America, which is not so important in Europe, thank goodness, is the issue of race. And one of the things that stops America having a fully developed welfare state and good health care is that people don't want to pay for health care, or they don't want to pay for benefits for people who don't look like them, which means that many white people, are resistant to paying taxes that would help the African American community. And of course, rural America is largely white, and many fewer African Americans in rural America. So all of that goes into the mix. I do think one thing that will be true everywhere, including in Europe, is that we've not had a large-scale pandemic like this for a century, and so we're going to have to rethink a lot of things, a lot of adjustments to healthcare that will make it possible to deal with recurrent pandemics if that's what we're in for, and also a lot of more infection proofing at work and transportation and so on, which will make it easier to deal with. Just one final thing. It was when you said about Lombardy having done really badly. Well, Lombardy did really badly because, Milan is a large trading hub, and Milan was open to the virus in a way that a lot of areas in rural Italy was not. And the same is true in New York. I noticed that Republican politicians in the US have started blaming New York for the large number of deaths and said, it just shows how badly run democratic states are. And that seems to be just absurd. So I'm sure that healthcare everywhere will change as a result of this pandemic. Exactly how is pretty hard to predict.
Affecting also Republican states. And that will be interesting to monitor during the elections. We'll have the mail vote, most probably done in places where the pandemic is more widespread. We have another question. There are many, but there is one which I think is very interesting. During your lecture, you stated that differences in education are key to understand the widening of the gap in terms of mortality rates. What can we do to improve the equality and the opportunities for U.S. students? Some said that the debt of U.S. students to fund their studies would have caused the blasting of another maybe the universities in the U.S. are too expensive, I don't know, but the blasting of the bubble. Can you comment on the impact of education on mortality rates and life expectancies?
Okay. I think there are two effects here that are important. One is any possible direct effect of education on health. And better educated people are different in many cases. And they may be more forward-looking, and they may learn things in school or in college which make them more healthy. But actually, I don't think that's the biggest effect. I think the biggest effect is that education qualifies you for a job. And that's one of the reasons I read the Sandel quote, that if you don't get a good job, you don't get the social esteem, you don't get the dignity in your life. And the lack of good jobs has undermined what was a efficient, long-lasting, white working class culture in the United States. And the automation, the globalization, and also the American government gives huge tax incentives to replace people with robots, which is crazy. And also the healthcare system, by being funded through employment, means it's very employers tend to shed less educated workers. So that, large firms in the United States that used to have their own drivers and cleaners and mail delivery people and security, none of these firms have those people anymore. They hire them from contractors from the outside. And that converts what were good jobs, even if they were relatively menial jobs in large firms, to really bad jobs. In many cases, really bad jobs with outside contractors. most of the people who work in Amazon warehouses don't work for Amazon. They work for contractors who provide labor to Amazon. So the educational qualification, and it may just be the qualification, it may not be who you are. Many of these jobs may be perfectly doable by other people, but we built a society in which you only have access to these good jobs, or increasingly only have access to these good jobs, if you've actually been to college. So I think more people should go to college. I think that would be a good thing. But I don't think everybody has to go to college. And I think one of the things we're very bad at in the US, and many European countries are better at, is having alternative lines to good jobs that don't depend on having a 4-year college degree. We have a very odd system here that all the money that's spent on education is laser focused on getting kids to college, but only a third of them get there. So why don't the other 2/3 have any claim on those resources? And we need a much wider range of training. So that would be a really good thing. And then finally, I agree with you. I think our universities are much too expensive. I think I am now retired, but when I was teaching at Princeton, I got paid, which as a young man, I would have thought was an absolutely absurd salary. And I think it's because the universities, like many other professions in the US, have been very good at rent seeking and increasing their incomes at the expense of everybody else. One final thing, remind you what Anne said, that state universities, which used to be very cheap, are not cheap anymore. So their prices have gone up a lot too. And at least some of that is due to the exorbitant amount of money that states have to pay for healthcare.
Very final question, which I have just received. You said that one of the reasons why people with a low education are more at risk of contamination is due to the fact that they cannot work remotely. They have to go to the workplace, in particular in certain very inhabited areas. They are at risk of contamination. But also for workers working remotely from home, there might be new inequalities adding up to the former inequalities, because working from home can be very different. There are people living in very small houses with many other people. Maybe they have disabled persons or people who should be cared for. Others who live in large houses and can work comfortably and happily. So is this a source of inequality on which we should investigate more in the future? Should we be concerned of the potential new inequalities connected with remote working, which is called smart working, but it is not always so smart?
I agree. Most of us are very tired of remote working, but we're also very glad that we don't have to go out and take risks with ourselves. But the point you make is a really, really important one. And it goes with something I said at the very beginning about old inequalities that we didn't pay much attention to become incredibly important. So, having high-speed internet in your house, that's a good thing. And it's become an essential thing. So that inequality that was there but didn't seem so consequential has now become extremely consequential. And, sending your kids to school when you have a lousy internet connection or no internet connection at all. I don't know, many people here probably once upon a time or have had to use the internet connection in a hotel. While many of the poorest Americans, often women with kids, are put up by authorities in hotels, and their kids have to try and use the internet in the hotels, which is just not good enough to support learning. So that's exactly a good example. But another example, which is my favorite one, is, we have a big garden sort of behind me as I sit. There's a lovely garden where we spent a lot of time this summer. Now, some people have big gardens, some people have no gardens at all. Some people have apartments with no gardens that can only be got to by elevators. So that's an inequality, a difference between people that we thought was just part of, having more money or less money, or people who choose to live in the city and are happy to go in elevators. And then the pandemic comes along, and it's a really bad thing to be 30 floors up and to have to wait because there are restrictions that only 2 people are allowed in the elevator every time. We have friends, it takes them an hour to get out of their apartment every time. So these are, differences between people that we probably wouldn't even probably have labeled as inequalities before, but have suddenly become really, really consequential. It may just be for this pandemic. We may pay more attention to those, but absolutely, the pandemic does open up these cracks that we knew were there, but didn't pay a lot of attention to. And now we're falling into those cracks. So that's just a great question to end on. So thank you.
Grattacielo con l'ascensore.
The skyscraper and using the elevator is a good one. Thank you very much for your brilliant lecture, for answering so kindly to all our questions. There are not many people here, but I think that we could join hands on behalf of the people who are present virtually. This is the last event of the festival, so allow me to conclude. The gamble we took was to reach a very high number of people online, since they could not attend physically. And we indeed, I think, were able to win that bet. And the outcome is very encouraging. 100,000 people followed the lectures entirely. The number of events this year is limited because there were not many venues available. They had to be sanitized. We had 30 events this year. There used to be 120 on average in the past. Notwithstanding this, the number of followers is nearly the same. So they were a real crowd. They attended online. On average, every event had 3,000 visitors. 6 million people were connected to see bits and bits of the lectures, but there were 3,000 people following the whole event, with some differences, and we will be able to identify the subjects of the topics which are of great interest for the people. That's encouraging for the future, because we will combine the physical presence of people. We will never give up the idea of having crowds in the conference hall. We love the questions directly. We love to have a discussion in the squares in Trento. Well, at the same time, we would love to reach the highest number of people online. So this is an experience that we will repeat in the next years. So thank you all. I, in particular, would like to thank the engineers, the sound engineers who made this possible. We had no major technical problems, maybe some delays, but it was not our fault. Yesterday, the Prime Minister started very late, but not because of technical problems here. And during all other events, the quality was extremely good at the height of such an important event. And as I told you at the beginning, today we have a very well-structured archive. So you will be able to download. I'm sure that the number of visitors will increase in the coming days and will continue to do so, because we will have the opportunity to listen again to the lectures. Last but not least, I'd like to remind you that we have decided to devote this Festival of Economics to Alberto Alesina, a very important economist who passed away last May. And you can follow his lectures. There are 5 of them delivered at the festival, and you can watch them in our account. Thank you very much, and I hope to meet you again in presence next year.